Well, hello there, everyone. I'm Dr. Leslie Kernisan, board-certified geriatrician and the founder of the website betterhealthwhileaging.net. And this is the Better Health While Aging video podcast, where we discuss common health problems that affect people over age 60 and the best ways to prevent and manage those problems. We also often address common concerns and dilemmas that come up with aging parents and other older loved ones, like what to do if you're worried about falls or safety or memory or even the quality of an older person's health care. In today's episode, I'm going to talk about a very common nutrition-related problem that affects many older adults, and that is vitamin B12 deficiency. I think this is a really important condition for older adults and families to know about, and here's why. So first of all, it is common, and it becomes increasingly common as people get older. And so depending on the study and who they were studying, which group of older adults, they find that anywhere from 3% and in some groups, even up to 40% of older adults are having some form of vitamin B12 deficiency. And this matters because vitamin B12 is really important to the body, and it especially affects red blood cell function. And so if you're deficient, it can cause anemia, and it can also cause or worsen cognitive problems or walking problems because vitamin B12 is also really important for our nerve function. Lastly, I think it's important to know about this because it is unfortunately easily missed in primary care. So it's a great condition to know about to help you advocate and make sure that you're getting the care that really works for you or for your older loved ones. So in this video, I am going to break down what I think is most important for you to know about vitamin B12, how it works, what to look out for, how to make sure you don't have a deficiency missed. But before I go into what I'm going to be covering in this episode, I just want to briefly make a quick ask. If you have been enjoying the video podcast, would you please consider subscribing to the channel? It does really help people find the channel. It helps support the work I'm doing, and I would really appreciate it. Okay, thank you so much. And so now, yes, in this video, what I'm planning to cover, first of all, I'm going to talk about what exactly is vitamin B12 and what does it do in the body. And then I'm going to talk about why are low levels so common in aging? What happens as we get older that makes this more and more common? I'm going to cover symptoms of vitamin B12 deficiency, and I'm going to talk about why it's often missed in older adults. And then I'm going to tell you when I recommend an older person be checked for possible vitamin B12 deficiency. I'm going to talk about how it should be diagnosed, how it can be treated, and also even how it can potentially be prevented. Also, I just want to mention that I do have an article on Better Health While Aging that goes into all this material in depth. So please don't feel like you have to take too many notes because you can find all these key points summarized in the related article, and there will be a link to it in the description of this video. So let's get started. What is vitamin B12? So it is also called cobalamin, and it is a water-soluble vitamin that plays key roles on DNA synthesis and cell division. So there are parts of our bodies where we have cells that are rapidly dividing, and the vitamin B12 is especially important there because whenever our cells are dividing, they need vitamin B12 as part of that process. And actually our bone marrow, which is constantly making red blood cells and other blood cells, is a place where we have lots of cell division. Vitamin B12 also plays key roles in nerve functions, both the nerves outside the brain and inside the brain. And many of these functions that it does in the body are in tandem with folate, that is vitamin B9. Now, it's much less common for people to be deficient in vitamin B9. Now, when women are pregnant, growing a baby, their bodies need more folate. That's why prenatal vitamins with folate are especially recommended for pregnant women. But otherwise, in the United States, a lot of foods are fortified with folate. And so although we do see deficiency, it's not as common as vitamin B12 deficiency. Where do we get vitamin B12? It is actually present in most animal products, but not really in plant products. So if you eat meat or even eggs and dairy, you're generally going to be getting a fair amount of vitamin B12. But people who are vegan have to be a little bit careful because if they're not intentional about maybe using a supplement, they can become low. And although it's not naturally present in plant foods, some vegetarian foods are fortified actually with vitamin B12, such as some cereals. How much should you take? It's a very important vitamin, but you only need a really small amount every day. And so the recommended daily intake is 2.4 micrograms per day. And then the body does have a system for storing vitamin B12. It gets stored especially in the liver and also in other parts of the body. And so what that means is that normally, if you've been taking in enough vitamin B12, you actually have a stash in your body. And so if for some reason you were to stop taking in vitamin B12, maybe you decide to become vegan, or I'm going to explain later that one of the ways that people become deficient is that their body starts having difficulty absorbing vitamin B12. If you stop taking it in and absorbing it into your body usually still has enough to keep going with vitamin B12 for about a year. And only after that are you going to start experiencing symptoms related to a deficiency. So, how do we usually obtain and process this vitamin? I want to go into this a little bit just because I think understanding this then can clarify why older adults in particular tend to have difficulty at some point getting enough vitamin B12. So, first of all, a Western non vegetarian diet, an omnivorous diet, generally will contain 5 to 7 micrograms of vitamin B12. So, that's more than enough to meet the recommended daily allowance. And if you're taking a multivitamin, that often contains a certain amount as well, often 12 to 25. I think I looked at the label for Centrum Silver and it was 25 micrograms. And some vitamins will contain even more, maybe up to 100 or even 200 micrograms. And so after you take in the vitamin B12, either because you're eating animal foods or maybe a fortified vegetarian food, or you've taken a supplement, the vitamin B12 has to be processed by acids and enzymes that are in the stomach. Also, some of them are in the small intestine and related to pancreatic function. And after that processing, the vitamin B12 can be absorbed by the small intestine and then further processed in the body. And in particular, there is a protein that is called intrinsic factor. I know it's a sort of strange name, but it is secreted in the stomach by the cells that line the stomach. And it binds to vitamin B12. And then later in the small intestine, it's that compound together that gets absorbed efficiently by the small intestine. So if there's not intrinsic factor, the body actually has trouble absorbing vitamin B12. Now, it can passively absorb on its own with no intrinsic factor some vitamin B12, but it's really a very small amount of the vitamin B12 that is present. It's estimated at about 1% or maybe a little bit less. And then again, as I was mentioning, it gets stored in the body, especially in the liver. So why does it become so common for people to become deficient in vitamin B12 as they get older? Well, it turns out that as people age, they tend to develop conditions that decrease their ability to absorb vitamin B12. So common causes for this include, first of all, lower levels of stomach acid. This can be due to a weaker stomach lining, a condition that sometimes is called atrophic gastritis, or it can be due to medications to reduce stomach acid. Many people at some point take medications to reduce stomach acid, especially if they've been suffering from heartburn or from gastroesophageal reflux disease, a condition like that. Then there are other medications that people might be taking not for reasons related to their stomach, but that can still interfere with vitamin B12 absorption. So a really commonly used medication that does this is metformin, which is a medication we've used for a long time for diabetes. Now, if you're on metformin, I don't want to encourage you to stop. Metformin actually has a really great track record as a safe diabetes medication. And also there's evidence that it helps in other ways counter the biological effects of aging. It's being studied for anti-aging, but it does interfere with vitamin B12 absorption. It's important to know that. Another condition that can be related to vitamin B12 deficiency is alcoholism. People who drink a lot of alcohol often have a very irritated stomach. All that alcohol is not good for the stomach lining, and so then that can interfere with absorption of vitamin B12 or other nutrients. Then there are some people who have had surgeries to remove parts of their stomach or intestine. This might be an intentional weight loss surgery, or it could be related to having a tumor removed or some kind of gastrointestinal condition. Lastly, any problem that causes poor absorption in the stomach or intestine, such as Crohn's disease or celiac disease, can also cause decreased absorption of vitamin B12. So because of all these conditions, what we know is as people get older, they are more and more likely to have decreased absorption of vitamin B12 and to suffer from a vitamin B12 deficiency. So what would be the symptoms of vitamin B12 deficiency? So as vitamin B12 is especially vital for red blood cell function and for nerve cell function, symptoms of deficiency tend to be related to problems that are related to those two types of systems. So first of all, one symptom that people can get if they've had vitamin B12 deficiency for a while is anemia. So that means a lower than usual red blood cell count, because again, the vitamin B12 is necessary to make red blood cells. So if people have a deficiency of vitamin B12, they can get anemia. They usually get a type where the red blood cells are bigger than usual, as opposed to iron deficiency anemia, where red blood cells are smaller than usual. And then the anemia itself will cause symptoms like fatigue or shortness of breath. And if you'd like to learn more about the different types of anemia, the symptoms, how it gets detected, I have a video that covers just that. Then that will go into that in more depth. Another type of symptom that people can get from vitamin B12 are symptoms related to what we call neuropathy. Neuropathy is basically a condition where our peripheral nerves, the nerves that we have in the body that go out into our skin and muscles to give us sensation and also to control our muscles. Neuropathy is when those nerves aren't working well. And so that can cause symptoms related to the sensory aspect, like tingling, numbness, burning. And it can also cause symptoms such as poor balance and walking difficulties, which are often related to a combination of not sensing things well and then not controlling perhaps the muscles quite as well. And then another potential symptom of vitamin B12 deficiency is cognitive impairment, meaning problems with memory and thinking or processing speed or executive function. And it can even sometimes manifest as irritability or impatience or almost a little bit of a personality change. And so that happens because we have nerves in our brain. They are the ones who are managing our memory and thinking. And so if they're not doing well enough because they don't have the vitamin B12 they need, we can get symptoms related to that. So those are the symptoms of vitamin B12. Now, I also want to point out that this isn't really a symptom because it's not something that people feel, but a potential sign of vitamin B12 deficiency is elevation of other compounds in the body. Vitamin B12 is used to process various substances related to body metabolism. And so often when people are low in vitamin B12, they can have an elevation in certain compounds, notably something called homocysteine, which is sometimes checked as part of an inflammatory panel, and also methylmalonic acid, which I will talk about a little bit more when we talk about how low vitamin B12 gets diagnosed. Now, you may have also heard a term related to vitamin B12 deficiency, which is called pernicious anemia. So if you're wondering, what about pernicious anemia or what is pernicious anemia, let me talk briefly about that. So that is an older term that is related to a time long ago in medicine when doctors noticed that, there were people who would have this type of anemia that had bigger than usual red blood cells that was related to low vitamin B12. And the reason why they were having low vitamin B12 is because they were having a problem with their stomach lining and the production of intrinsic factor. So pernicious anemia essentially relates to this form of vitamin B12 deficiency, where it's caused by the loss of the body's ability to make intrinsic factor in the stomach's lining. And it's estimated to affect about 2% of older adults. So again, the lining of your stomach is what produces intrinsic factor. And when people have pernicious anemia, they've often experienced an autoimmune process that has damaged or destroyed those cells that create the intrinsic factor. This is also called autoimmune atrophic gastritis. And so without that intrinsic factor, they're not able to absorb vitamin B12. And so if they're getting just normal amounts of dietary vitamin B12, they can't absorb it enough. And so their levels eventually start to drop. And then they can eventually get anemia. However, it is possible for people to have pernicious anemia, meaning this autoimmune condition affecting the lining of their stomach and not making intrinsic factor, and not yet have anemia. Sometimes people can have low vitamin B12 and have symptoms related to nerve function or cognition that happen before they have an obvious anemia. So that is pernicious anemia. So now, given that this is so common, why is vitamin B12 deficiency often missed? And the reason for this is that, especially when it comes to older adults, it gets missed because those symptoms that I talked about are what we call, first of all, they're common, but they're also what we call nonspecific, meaning they can easily be caused by a large variety of different health problems, or in older adults, often by a combination of health problems. So again, the symptoms of vitamin B12 deficiency are things like fatigue, anemia, neuropathy, cognitive issues or cognitive decline, walking problems. And these are things that we see really often in older adults, and often they are what we call multifactorial, which means that there are multiple things that are contributing to this problem in an older adult. These problems are also often waved off, unfortunately, in primary care as kind of part of aging or just not really worthy of more investigation. And that is a form of ageism that we see in medicine. Another issue is that vitamin B12 deficiency is almost always something that comes on slowly. In medicine, we refer to this as something that, comes on insidiously. It comes on little by little. So it's not like one day you're fine and the next day, boom, you're tired, you're having trouble walking, you're having trouble thinking, and you've had sudden onset of vitamin B12 deficiency. It doesn't work that way. It tends to come on little by little by little, which means that people may not really notice the symptoms or that the health providers don't really pay attention to the symptoms. Lastly, what I have noticed in reviewing people's charts is that sometimes vitamin B12 is checked in the bloodstream, and a certain number of older adults will have a level that we call low normal. And so that means that it's just at the lowest in the lower part of what is considered normal. Well, ideally, those people would get a confirmatory test, but this is not always done unless health providers are paying attention or unless patients advocate. So, this is an important issue because there are lots of health problems that affect older adults, but unlike many of those, vitamin B12 deficiency is actually pretty easy to diagnose and pretty easy and safe to treat. So, this is a condition that I think is a shame to miss because that is not true of all problems that affect older adults, that they are easy to treat. And the key here is really detection. It's noticing it. And so that is why I am here to talk a little bit about this problem, bring it to your awareness, and talk about how it can be detected, diagnosed, and treated. So, who should be checked for vitamin B12 deficiency? So, it's not recommended to check everybody, but there certainly are some groups of people who should be checked. And so, first of all, any older adult who has symptoms that could potentially be vitamin B12 deficiency. So, that includes symptoms like fatigue, anemia, neuropathy, memory or thinking problems. When I'm evaluating people where we have concerns about memory or thinking, that's definitely on my list of things to check is vitamin B12 or walking problems. Those are people in whom we should check and make sure that they're not deficient in vitamin B12. And then it's also a good idea to consider checking any older adult who has risk factors, such as taking a medication like metformin or antacid medications, having known issues with their stomach, their intestine, or their gastrointestinal absorption, drinking a lot of alcohol, or somebody who is vegetarian or vegan. How do we test for vitamin B12 deficiency? It's actually pretty simple. First, we do a blood test, what we call checking the serum level of vitamin B12. And the serum in the blood is the part of the blood that is not your actual blood cells. A normal level is usually 300 picograms per milliliter or higher. And then often if we're doing this, and it's possible that it's being done because there's been an anemia and maybe the red cells are a little bit bigger than usual, they will also check for folate because folate deficiency can also cause many of the vitamin B12 symptoms. That said, folate deficiency is much less common than vitamin B12 deficiency. And then it's not absolutely necessary, but often a complete blood cell count is often done to check and make sure that the person doesn't have anemia. It would also be a relevant test for somebody who's having a symptom like fatigue, which could be related to anemia. Now, again, even though vitamin B12 deficiency can cause anemia, it's important to know that it's possible to have clinically low vitamin B12 levels without actually having anemia, a lower than normal blood cell count. So a normal blood count is not a reason to not check vitamin B12 levels. And I say this because occasionally when I have talked to families or reviewed charts, I've been told that, when they asked about checking vitamin B12, they were told by the health provider, oh, that's not necessary because there's no anemia. Well, that's not entirely right. It is possible to be having other types of symptoms with a low vitamin B12 level before the actual anemia develops. And we also don't want to be waiting for things to get so bad that people are actually experiencing anemia. So, next steps on the testing. So after we get a serum level, then, what do we do with the results? So if it's quite low, like under 200, then definitely we have a vitamin B12 deficiency. We want to treat it, potentially investigate what's the underlying cause. But if the serum vitamin B12 is low normal or borderline, so for instance, between 200 and 400 picograms per milliliter, then the next step would be to check a confirmatory test, which is checking methylmalonic acid. So what is methylmalonic acid? This is a compound in the body that is kind of an intermediary in this metabolic reaction. So as part of an important, very common metabolic reaction, vitamin B12 is needed to convert methylmalonic acid into the next compound in the biological reaction. And so if your body doesn't have enough vitamin B12, then the methylmalonic acid starts to accumulate. because the vitamin B12 is not there to help it move along and convert into the next compound in the reaction. So this is the most common confirmatory test. And if the body doesn't have enough B12, then the levels would go up. So when we have vitamin B12 deficiency, we generally would see a low or borderline or maybe low normal vitamin B12 level and a higher than normal methylmalonic acid level. And higher than normal methylmalonic acid levels indicate a clinically significant vitamin B12 deficiency. And then there might be additional tests that get ordered, such as tests for pernicious anemia, if there are other reasons to believe that might be the cause. So what additional tests are done to find the underlying cause of vitamin B12 deficiency is going to depend on circumstances. I mean, if a person says, oh, well, I went vegan 5 years ago, it's potentially going to be attributed to just being vegan, and they're not necessarily going to do all the rest of the work. So once we've confirmed that we have a low vitamin B12 level and a deficiency, how do we treat it? Well, luckily, treatment is pretty straightforward. It's to give supplemental vitamin B12. It works really well, can be done with prescription formulations or even over-the-counter formulations I have found are effective as well. So a very common dosage is 1,000 micrograms, and this can be given either as an intramuscular injection or as a daily oral tablet. So vitamin B12 is not given IV, intravenously. It is either a shot in the muscle or a daily oral tablet. And one of the many good things about vitamin B12 treatment is that it's very safe. You cannot overdose on vitamin B12. If you take in more than your body can manage or process, it just gets peed out. Now, you're probably wondering, well, how should it be treated? Is it the shot or is it the supplement? Which one is better? So let me talk a little bit about that. So for a long time, the convention was to treat especially with shots, but then studies were done, and what they found is that high-dose oral vitamin B12, such as a dose of 1,000 to 2,000 micrograms per day, is as effective as intramuscular shots for treating vitamin B12 deficiency. It gets the levels up. And what's really cool is that this works even in cases of pernicious anemia. And that's because, again, the best way for your body to absorb vitamin B12 is, by pairing it with intrinsic factor and taking it in. And if you get an intramuscular shot, then you're bypassing the whole stomach thing. You're just putting it into the bloodstream. But even if you don't have intrinsic factor, you have pernicious anemia, there's again that inefficient passive system for absorbing vitamin B12. And so when we give people a dose of 1,000 to 2,000 micrograms per day, it's such a big dose that in absorbing that 1%, the body is getting more than enough. And we do see levels go up and symptoms can even start to resolve. Now, there is a caveat with this oral approach, high dose approach, which is that the person must be reliable with daily dosing. You have to be able to take it every day consistently for, months to recover your vitamin B12 stores. So this is an issue that comes up, especially for me in geriatrics, because there are a certain number of older adults who are not taking their medications consistently for various reasons. It might be that they have a lot going on in their life, but often it can be related to having some problems with memory or thinking, especially if they live alone. Those can be people who are not going to be able to reliably take the medicine every day. And so for those people, it can be a better choice to go with a shot where you know exactly that you gave it to them, they got it. Also, intramuscular treatment, the shot does raise levels more quickly. And so that's especially advantageous if the deficiency is very severe, like the B12 level is really, really low, or if they're having really significant symptoms that seem to be related to vitamin B12. That said, often when we detect vitamin B12 deficiency, the deficiency is fairly mild. It's not clear that the person is having severe symptoms. And so then it's not like an emergency to bring up the level. And that's why oral treatment can be okay, because oral treatment is often more convenient. So, lots of people don't like shots. Now, if we go with the injection method, one common way to do it is to do weekly injections for 4 weeks, so once a week for a month, and then switch to monthly. And then after that, how long do people need treatment? A lot of people get treated actually indefinitely. So once we start treatment, how fast does it work? So especially if we're going with oral treatment, it can be a really good idea to recheck the serum levels within 2 to 4 weeks. We should really see a significant rise by then. And then in terms of how fast the body responds, a normal, healthy bone marrow should respond to vitamin B12 pretty quickly. So in a normal healthy bone marrow, they'll see signs that, the body is able to make red blood cells more efficiently. And within, 1 to 2 weeks, they'll see improvement and the blood cell count might normalize within a month or two. Again, how long it takes depends on how far down it was before. Now, many older adults don't have entirely normal bone marrow, but as long as we've gotten their serum levels up, we've done what we can on that front. Recovering nerve function, as far as we can tell, takes longer. It's thought to take probably at least 3 months before the nerves are really much improved, and it might take up to a year. And then in terms of how long to treat, because often the reason why older adults became low, has not been entirely resolved, in many cases, we just continue with indefinite treatment. So especially for those people who've been having monthly B12 injections for a while and are kind of tired of it, especially if you've built up a nice big store, you could potentially switch to oral vitamin B12 instead, and then just get the level checked every few months to make sure you're maintaining a good enough level. So that is how we treat vitamin B12 deficiency. Now you may be wondering, well, is there a way to prevent this in the first place? And the answer is yes. So basically, it's the same as the treatment. So especially if you have risk factors for developing deficiency, you can consider taking a daily vitamin B12 supplement of 1,000 micrograms per day, and that will probably keep you from being deficient. In fact, I myself, on one of my blood counts, my red blood cells were a little bit bigger than usual. They checked, my vitamin B12 was a little lower than expected. Nobody's really sure why. And so I take vitamin B12. The one that I take is from this brand, Thorne, which you can get on Amazon. But before I started using that one, that was recommended by a colleague who does a lot of functional medicine. There's also another one that is dissolvable, so very easy to take. And that raised my vitamin B12 also. So it's pretty simple. A lot of over-the-counter vitamin B12 supplements will raise your level. If you're interested in either of these, I'll post an Amazon link. It is going to be an affiliate link, which means that if you buy through the link, you will be helping to support the video podcast and Better Health While Aging. Thank you for that. But yes, it really can be that simple to prevent a vitamin B12 deficiency or treat a mild deficiency. And then what you can also consider is adding a high quality multivitamin, which will provide other levels of other B vitamins that can help lower things like homocysteine in the body and might help improve health. The research on this has been a little bit mixed. There was hope at one point that giving people B vitamin supplementation would reduce cardiovascular disease because low B12 and also higher homocysteine have been associated with cardiovascular disease, but in randomized trials that did not pan out. But there are some other studies that suggest that it might help with a few other aspects of health. And there may be other benefits to a good quality multivitamin as well. In terms of the multivitamin that I take the one from Adapt Naturals, and I can post a link for that. It's a little bit more expensive, but in studies, even taking something like Centrum Silver, may have some health benefits for older adults. So that is an option as well. And so that is what I think is most important to know about vitamin B12. So to recap right now, what you should know is that vitamin B12 deficiency is very common, and it becomes more common as people get older. Low vitamin B12 affects blood cell count and nerve function. So that means the symptoms are often related to those symptoms. They can include things like fatigue, anemia, neuropathy, cognitive issues, and walking problems. But you should know that these kinds of problems in older adults can easily be caused by other health problems too. So often treating a low vitamin B12 level is part of the management, but people might need more help or more evaluation for those problems as well. Who should be checked? Older adults with symptoms or risk factors should get their vitamin B12 level checked to make sure they're not deficient. So the risk factors, are especially things like being on metformin or on anti-acid medications, having known stomach, intestine, or absorption issues, drinking a lot of alcohol, being vegetarian or vegan. And you should know that it is possible to have clinically low vitamin B12 levels without having anemia first. So you don't need to wait until there's actual anemia to check for vitamin B12. I recommend checking sooner if there are any potential symptoms or risk factors, because it is, again, very common in older adults. Checking for deficiency involves checking the serum vitamin B12 level. That's a straightforward blood test. And then if that result is low, normal, or borderline, check methylmalonic acid, which goes up when the body is low on vitamin B12. And then additional tests may be needed to identify an underlying cause. Treatment is safe and effective. You can't overdose on vitamin B12. 1,000 micrograms can be given orally or intramuscularly, and which route depends on, how severe the deficiency is, how urgent it is to bring up the level, And also for oral treatment to correct a deficiency, you want to make sure that the person can take it daily and consistently. But otherwise, it has been proven to be effective and can be a more convenient and cost-effective way to treat vitamin B12 deficiency. So with that, thank you so much for watching. And if you found this video podcast helpful, if you're here on YouTube, please go ahead and subscribe. It really does help more people find the channel. If you've been listening to the audio version on the podcast feed, come and take a look at the video if you get a chance. You'll be able to see my key points being displayed on the screen. So thank you once again, and I look forward to seeing you all again on a future episode of the Better Health While Aging video podcast.